Welcome. On behalf of the Huntington Society of Canada, I would like to extend my gratitude for this opportunity to share information with your law enforcement program or detachment about Huntington disease. The purpose of this brief presentation is to assist law enforcement with their understanding of Huntington disease or HD. Symptoms of HD often intensify in stressful situations and could be misunderstood and even cause unintentional conflict with law enforcement. Today we're going to take a look at what is HD, who gets HD, common interactions between law enforcement and individuals with Huntington disease, and 3 symptoms of Huntington disease broken down into our acronym of MET, movement, emotional, and thinking symptoms. And last but not least, we'll leave you with some resources to assist you further. What is Huntington disease? HD is a hereditary neurodegenerative disorder caused by a genetic mutation. This mutation triggers the progressive death of very specific brain cells, leading to stages of symptoms that manifest and progress differently in each individual. Currently, there is no cure for HD, but medications can help manage some symptoms. Huntington disease affects 1 in 7,000 Canadians. Every child born of a parent with HD has a 50% chance of inheriting the mutated gene. Symptoms typically develop between the ages of 35 and 55, gradually worsening until the individual requires assistance with daily living. Note that there is nothing anyone can do to avoid developing symptoms or stopping its progression at this time, as it is a genetic disease without a cure. Eliminating the criminalization of illness-induced behavior is a mutual goal of the Huntington Society and law enforcement agencies. Interactions that most frequently occur between law enforcement and someone with Huntington disease are traffic violations and violence towards carers. Why are these scenarios so common? Due to common misunderstandings. Uncontrolled movement is often the most immediately noticeable symptom and may be mistaken for drunkenness or substance abuse. Police officers are often the first to respond to emergencies and are frequently challenged to differentiate between a mental health crisis and intentional criminal behavior. Those with HD are no different. Cognitive symptoms can make self-regulation difficult, which may result in unintended conflict with authority. It will continue to be a challenge for law enforcement to distinguish between HD and other causes of behavior. However, being aware of these misunderstandings can assist officers with this particular disease. If you suspect someone has HD when you encounter them, you can inquire with that individual as to if they have a pocket card identifying their HD status. Often described as a combination of Alzheimer's, schizophrenia, and Parkinson's, Huntington disease symptoms are devastating to individuals and families. We'll take a closer look now at HD and how law enforcement might handle some specific situations by breaking down the 3 areas of impact: movement or physical characteristics, emotions or psychiatric symptoms, and thinking or cognitive challenges. So what are some of the cognitive symptoms of Huntington disease? HD affects how the person thinks, often leading to difficulty with things like focus, planning, recall, decision-making, impaired insight, and impulsivity. Improving focus by maintaining eye contact and refocusing the conversation as often as necessary when there are distractions can be helpful. Avoid asking the person with Huntington disease to make a plan. Use simple yes or no questions. Recall of information is slow. Allow the person time to process questions and formulate answers. If you need a question answered more quickly, revert to a yes or no response. You can and should inform the person about the consequences of their behavior, but be aware that HD impacts how a person appreciates or interprets what you have said and those consequences. Impaired insight may confuse the person when confrontational actions are intended to protect. In the same way, loud speech intended to control a crowd or a situation might frighten the person and escalate their emotion. Slow physical movements and reactions when possible to allow the person time to process them, as fast movements are confusing and may result in fear and an escalation of the difficult to manage behavior. Impaired impulse control may prevent a person from discontinuing inappropriate behavior despite your best efforts. What are the physical symptoms of HD? HD affects how the person moves, often leading to involuntary dance-like movements, also known as chorea. Balance challenges and difficulty walking may require hands-on assistance for safe mobility, as the risk of falling is high. What might look like resistance may be diminished coordination or involuntary movements. The use of restraints may increase the risk of self-harm due to those involuntary movements. The movements will not stop if restrained. Due to difficulty swallowing, you may see uncontrolled drooling. Be alert to the risk of choking, especially when eating and drinking. Slurred speech is common and difficult to understand. The individual may become frustrated if you don't understand what they are trying to tell you. In advanced HD, speech may disappear altogether. Using assistive technology and gestures can be useful. People in the more advanced stages may be thin and look malnourished and even unkempt due to weight loss. What are some of the emotional symptoms of HD? HD affects how the person feels and behaves, and they may experience depression, apathy, anxiety. They may require hospital evaluation if this is the case. Be vigilant about the heightened risk of self-harm, as the statistics are high. Unexplained anger can be attributed to symptoms of Huntington disease, just as irritability and agitation can be HD symptoms and not necessarily intentional defiance. Obsessive behaviors are common involuntary actions and can be difficult to stop. Perseveration, or the persistent repetition of thoughts, actions, or words, can be caused or exasperated by stress or anxiety. As with many of the behaviors and symptoms outlined here, you can best help the individual with HD by attempting to refocus them, speak and move slowly and calmly, allowing time to process, and creating a less stressful environment. However, for more information and resources, please reach out to your local resource center director from the Huntington Society of Canada. There is a package of information available for law enforcement and families. There are digital and hard copy infographics and posters available for you, as well as fact sheets designed for families in interacting with law enforcement, as well as law enforcement on more specific and helpful tips for interacting with those with HD. This PowerPoint presentation can be shared with other law enforcement departments, and a local resource center director is always available to do an in-service at any of your training days or education events. Please contact the Huntington Society of Canada and take a moment to scan the QR codes available here for more information and support. On behalf of the Huntington Society of Canada, I thank you for your time and willingness to learn more about Huntington disease.